So it all started about 50 years ago when a young Dr. John Sarno had graduated from Columbia Medical School, and he very quickly began working at NYU Hospital in rehabilitative medicine, where his job was to assist patients suffering from a variety of pain syndromes to get better. So at that point, he had been trained in the kind of the classic physical sort of explanations of pain. So he would treat his patients with physical therapy, massages, like exercises, etc. But he quickly grew frustrated because the vast majority of his patients, rather than seeing permanent cures, just got caught in cycles of managing their pain by having to, get treatment once a week or twice a week. And he became frustrated. He really thought doctors could do better, and they weren't tackling the root cause of what was going on. Because if they had, patients would get better and they wouldn't have to see him again. And this was about 50 years ago, and the dominant view at this time was that pain was due to some sort of physical degenerative processes. So he decided, let me research this and see if the data supports this assumption. So, first of all, he noticed that if pain is really due to degenerative processes in our spines and in our muscles, etc., you would expect that the vast majority of patients that come into the doctor will be older, will be in their 60s, their 70s, their 80s, because by then your mechanical body has been through the most wear and tear. Your joints and muscles and everything have been through the most wear and tear. They should have been degenerated, and you should have pain. So we looked at the data, and it's told a very different story. In fact, doctor visits tend to peak in your 30s and 40s for when you're going to see the doctor about chronic pain issues. It's not a straight line as you get older, you know, the more doctor visits. So he was like, that doesn't make sense. Secondly, he was astounded by the fact that chronic back pain had become an epidemic. It was growing at 14 times the rate of the population. And it didn't make sense to him. Like, how all of a sudden is everyone getting chronic back pain? We're human beings. We are remarkable species. We have emerged through evolution as the dominant species on this planet. And there is no possible way that could have happened if our backs were so fragile and we couldn't live normal lives because of our backs. He was just wondering, like, what the hell has suddenly happened to the American back after a million years of evolution and physical domination? The third thing that really stood out was at the time, if you had a back problem, you'd get some imaging, either an MRI or an X-ray. They'd see, okay, there's a bulging disc, a herniated disc, cracked disc, scoliosis, whatever. They'd see these abnormalities, and they would say, okay, your back pain is because of, these abnormalities. But what was happening is there was a growing body of research that basically suggested that what shows up on imagery has almost nothing to do with the actual pain you're going through. And essentially how these studies were done is they would basically take 100 people off the street who had never had pain in their lives, and they took x-rays of them and they took MRIs of them, and virtually all of these people had bulging discs and had herniated discs and had scoliosis and didn't have that natural S-curve, yet they were pain-free. They never had any pain in their lives. And many people who had pain didn't have any structural abnormalities. So what was happening was, since doctors didn't have a better explanation, they were attributing certain abnormalities in imagery to the pain sources, but the fact that people without pain also have these abnormalities, it just means that's an incorrect diagnosis. So, these three things really stood out to him, and it all kind of came together. He kind of made his big discovery once he started looking at the basically patient histories of, all the people who would come to him with chronic pain. And basically at some point or other in their lives, they had all experienced very similar medical histories. At some point in their lives, they had all had common respiratory issues such as asthma or seasonal allergies or common pet allergies. Common stomach conditions such as ulcers or like irritable bowel syndrome or colitis, heartburn, um, common skin conditions such as eczema or acne. Many of the patients had headaches. And he had long believed that this list of medical conditions that I just talked about were not actually due to physical processes. They were due to stress and tension. And he just made the conclusion one day that, maybe back pain also is rooted in tension and emotion. Um, and he kind of just, it was a hypothesis. He had no proof, but he thought, given what he had looked into, it made a little bit of sense. So he started sharing this information with his patients. And, instead of giving them a physical explanation for what was wrong with their body, um, he basically told them that your back pain is probably linked to psychological factors and unconscious stress. And the result of sharing this with his patients was they were healing. Like his success rates like skyrocketed and jumped through the roof. And he was puzzled. All he had done differently in his treatment program was give knowledge to his patients that their pain was psychological in nature rather than physical in nature. Um, and they were miraculously getting better after years of seeing doctors, after years of pain. Um, they were experiencing miraculous recoveries. And he wasn't a psychologist, so he didn't know how to explain it. So he basically teamed up with one to help him understand what was going on. And together, they basically came to the conclusion that there's basically this evolutionary glitch in how our minds have evolved to process unconscious stress. For some reason, our minds will go through great lengths to avoid dealing with unconscious stress. And it'll go through such great lengths that it will create physical symptoms such as pain in order to avoid dealing with these unconscious emotions. And basically, in other words, simplest terms, unconsciously, so without being aware of it, our minds are creating this pain in order to avoid us of thinking of deeply repressed emotions. And maybe that didn't make too much sense. I'm going to get into a bit more detail and provide some examples so it's not as abstract. But in order to understand it, you need to understand the difference between our conscious mind and unconscious minds. So I'm going to give you a crash course in psychology, free of charge. And keep in mind, what I'm telling you is fact. Like, none of this is theory. This is all proven. If you went to your university and took a psych textbook, all of this would be explained. But here's the gist.